We are the only democracy.
I haven't been to a primary care doctor in maybe 2 or 3 years.
For we cannot be a strong nation unless we are a healthy nation.
The only advanced democracy on earth.
Fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago.
The only wealthy nation.
Health care that can never be taken away. Health care that is always there.
I'm not the first president to take up this cause.
Nobody knew that health care could be so complicated.
But I am determined to be the last.
The question is, why hasn't it happened?
In one of last month's episodes, I talked about the outrageous price of prescription medications and the stark difference in price between the United States and Europe. And naturally, one of the big reasons for the differences in price between us all boils down to the single-payer system, often called universal health care, that we have here in Europe. And many of you in the comment section rightfully asked, if universal healthcare offers better access, better wait times, better prices, and better coverage, why won't Americans just adopt a public healthcare system already? Well, that's something that's a lot easier said than done, but it's a thought experiment very much worth exploring. You know, how would the United States adopt a universal healthcare system without simultaneously bankrupting the country? Well, let's dive in. Okay, so before we jump into what all of this would take in order to implement it, I want to just briefly explain what universal healthcare is in the first place for the Americans watching this video. But also for the Europeans watching, I think it's also important to give some context on just how massively expensive American healthcare is. Universal healthcare coverage, also known as public healthcare, means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. But despite the word universal, this is not a one-size-fits-all system. Public health care takes a variety of forms in different countries, and there are loads of different models that the US could theoretically look at in order to inspire their own program. Universal health care does not necessarily mean that the government is your insurance company. Here in Germany, for example, we have all sorts of insurance companies. They're just nonprofit. The government's role is to act as a mediator, making sure that the costs are fair for both the physician and the insurance company, and by proxy, you as a patient. But generally speaking, financing for healthcare either comes through taxes or funding through social contributions. Contributions, which I need to mention, are cheaper on average than private premiums paid by US families. And often these models come with no copays and no deductibles, which is why you hear the word free healthcare commonly thrown around. Because after you pay those dues, there's no surprise billing, and medical debt is largely non-existent here. Now, if you want to learn more about this in detail, please go ahead and check the video that I'm going to link right up here in the corner of this video to learn more about universal healthcare, because just for brevity's sake, I can't go into that depth of detail today. But it's important that we talk about cost because US healthcare is insanely expensive. According to the US government, the national healthcare expenditure grew by 2.7% and reached 4.3 trillion. That's trillion with a T, not a B, in 2021. And again, that represented a 2.7 increase over 2020, as well as an 18.3% share of the entire US economy. That works out to be $12,914 per person. All future projections see these numbers rising faster than the growth of the economy. And yeah, that's a bunch of numbers, but I want to specifically hone in on that 18.3% of the total US economy. According to the Organization for Economic Cooperation and Development, the average percentage of total gross domestic product consumed by the average developed country in the world in healthcare is just 9.7%. Now, that figure's for 2020, but having researched this information over the years, the percentage has risen slightly, but overall it's been pretty steady and predictable. It's the US where the percentage is rising most dramatically on a year-to-year basis. Now, for sure, that OECD comparison also includes countries that maybe might not be so comparable to the United States. But Europe and Canada are managing universal healthcare systems at about half the cost of the US on a per capita basis. And their programs might not be perfect, but they're still able to provide care with faster wait times, greater choice of physician, and overall better health outcomes than the United States. However, to roll out this kind of system with the current cost structures that currently exist in the United States would effectively, in my opinion, doom it to failure from the very beginning. In fact, it's kind of one of the reasons why Obamacare is kind of failing, but that's a discussion for a little bit later on in this video. But the US healthcare system as it currently exists is just too bloated to be scaled back and managed. So yeah, couple that with the fact that more and more healthcare systems are now owned and managed by private equity firms. It's not surprising to me that the entire industry functions on the assumption of ever higher revenues. It will take decades to reverse this dynamic, and that's even under the assumption that we can reverse it in the first place. But it's an assumption worth exploring. So let's take a look.
You want the best researchers, you want the best doctors, you want the best caregivers. How do you do that? You incentivize them to come into medical fields by maybe at some point making a good living. It's crazy how that happens.
Perhaps the biggest pill to swallow, metaphorically speaking, would need to come from the medical professionals themselves. I actually recently had a discussion with a nurse in the comment section of one of my previous videos. And in that video, she mentioned that she made an annual salary of $120,000 in the United States, and that if she was to become a nurse in Europe, she would effectively have to cut her income in half. And here's the thing, she's not wrong, but that doesn't necessarily make it right. It's not just the cost of medical devices and prescription drugs that are overinflated, but the entire medical industry. No, it probably doesn't make sense that nurses make more than tenured PhDs at major universities. But a nurse's pay should be somewhat relative to his or her colleagues. So if the doctor's pay is hyperinflated and the hospital administration incomes are hyperinflated, then it's also going to trickle down into every other profession linked to them. On some level, the entire healthcare industry is a game of whose line is it anyway?
The show where everything's made up and the points don't matter.
But at the same time, asking 22 million US workers who represent around 18% of the entire US workforce to basically take their paychecks down to reality globally speaking, I don't see that happening. I mean, it's not their fault that their industry is hyperinflated, and at the end of the day, a lot of these people chose these professions because they paid well, and it is important. And again, I'm by no means saying that this is anyone's fault. It's just that one of the biggest hurdles for universal healthcare to cross in the United States is that there's no way I can see it working without severely restricting reimbursements to healthcare practitioners. We can look to Medicare and Medicaid as examples of this process already in motion. As doctors begin to realize that their incomes are being reduced and their day-to-day operations are being closely monitored and controlled, the US would likely see a mass exodus from the profession. It might take the form of early retirements and fewer students going to medical school. Because, be honest, they're probably going to be less willing to take on the six-figure debt levels needed to attend it. And the end result will probably be fewer doctors and still higher fees for the services that are available. So yeah, at some level, you can't implement universal healthcare if you aren't also prepared to tackle the massive for-profit education model that predominantly exists in the United States. You'd have to be able to put together something that somewhat resembles what currently exists in Europe. An education model system that effectively allows medical students to go to medical school for a teeny tiny, almost insignificant fraction of the cost of what it does in the United States. You have to be able to get student loan debt under control and make it essentially not become a big factor in going into the profession in the first place.
Many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care. Now,
What? Did we just become best friends?
yep!
And speaking of the costs that doctors incur, it's often true that the single biggest expense in the practice is malpractice insurance. And I'm not talking a few $1,000s here or there. In some high-risk specialties like OBGYNs, it can easily be well over $150,000 to $200,000 per year per doctor. Now, it was actually surprisingly difficult to find good numbers on this because medical malpractice is handled so dramatically different in Europe. But in April of 2010, the Deutsche Arztversicherung announced a premium rise for doctors in general practice in Germany from 350 to 770 euros per year. In high-risk specialties, the figures were many times higher. Now, I admit, these numbers are quite a bit old. But even if you adjusted them for inflation, these are wildly different medical malpractice insurance rates. And listen, I'm not a betting person, but I would probably bet $1 million that Congress is never, ever, ever, ever going to do anything about the cost of legal services in the United States. I mean, come on, that ruling body is comprised primarily of lawyers. There's no way you're going to get them to support any kind of restrictions. Just look at the commercials for ambulance chasers on daytime TV. It's big business, and it's one of the primary drivers of the legal industry in the United States.
Brian Wilson, Texas Law Hawk. Talons of justice. Due process. Do wheelies.
So yeah, in my opinion, just like education reform, if we aren't also going to get serious about tort reform, you're going to essentially doom universal healthcare to failure before it ever takes off. We need to look at systematic change here.
Healthcare is not a right. Healthcare is a commodity. So the point I was making is if you view it as a commodity, you're going to end up making it cheaper, more plentiful, more available, more competition.
America is the land of the unlimited. For the first nearly 200 years of our existence as a nation, we had abundant everything. Abundant land, abundant workers, markets, energy, food, you name it. It's the kind of independence, real or not, that we've been chasing for generations. But back in the 1960s, then President Lyndon Johnson even promised that we could have it all.
So we want to open the gates to opportunity. But we're also going to give all our people, black and white, the help that they need.
And it's been the mentality in America ever since, and a big part of why it is supported by the monetary system, which probably not 1 in even 100 Americans actually understands. The United States government issues the US dollar, and it serves as the global reserve currency, which is to say that virtually every other currency in the world is tied to the dollar. And this gives the US the exorbitant privilege of paying its foreign obligations in its own currency. It's also the reason why we have inflation. All countries in the world create inflation by printing money. It's the kind of thing that you can do easily with paper and digital money. But the more money that's put into circulation, the higher prices eventually become. And Americans, in my opinion, have become very comfortable with the idea that our government will just essentially pay any price it has to. Sure, about every 2 years, we're treated to a political battle over cutting the budget. But it's really just political theater. Neither party is going to balance the budget because it doesn't matter. The government can print or borrow as much money as it needs for whatever it wants to do. Whatever treasury debt the government can't sell in the open market will be purchased by the Federal Reserve, which is empowered to literally print money out of thin air. My point is, Americans have become very comfortable with this arrangement. It's one of the big reasons why whenever other countries talk about de-dollarization, it scares the pants off of every politician. Because not only would that challenge our global dominance, but we probably quite literally could no longer write checks we can't cash. But that's a discussion for another day. The point here is that in the United States, the sky's the limit. And that's what we expect from the healthcare industry. We want the best healthcare money can buy, or at least the illusion that it's that way. And we want as much of it as we can get. At the same time, our expectation is that we won't have to pay for it. And that's a recipe for disaster. Government is careful to maintain pretty inflation numbers, but should we get universal healthcare but not simultaneously address the outrageous costs for nearly everything attached to it currently, we're essentially dooming it to failure. And that's exactly what happened with Obamacare.
What you need to understand is that there are 25 million Americans who aren't covered now. If the idea behind Obamacare was to get everyone covered, that's one of the many failures. In addition to premiums going up, co-payments going up, deductibles going up, and many Americans who actually did get insurance when they did not have it before have really bad insurance that they have to pay for. So it is chaotic. The status quo is simply unacceptable.
March 23, 2010, President Barack Obama signed into law what would become known worldwide as Obamacare. Although the actual name of the massive healthcare overhaul is the Patient Protection and Affordable Care Act, commonly called the Affordable Care Act. And that word, affordable, was the single most significant selling point of Obamacare when President Obama, his administration, and the Democrats in Congress shopped it to the people of the United States.
Affordable Care Act.
Affordable. The Affordable Care Act.
Unfortunately, Obamacare has been just about everything else but affordable. According to the Department of Health and Human Services, premiums have doubled for individual health insurance plans since 2013. The year before, many of Obamacare's regulation mandates took effect. So, what gives? It's complicated, but the Cliff Notes version is that we put into place measures that were good in theory, but not in practice with the current American for-profit healthcare system. In a presidential weekly address on July 18, 2009, President Obama said this:
Michelle and I don't want anyone telling us who our family doctor should be, and no one should decide that for you either. Under our proposal, if you like your doctor, you keep your doctor.
Unfortunately, a common and popular way to reduce premium costs was for health insurance companies to just reduce the number of doctors in the insurer's network, which leads to a much greater likelihood of people losing their doctors without the ACA. According to an NIH study, 15% of plans offered in the exchanges exclude doctors from at least one kind of specialty. And speaking in the Rose Garden on July 21st, 2009, President Obama also said this:
If you like your current plan, you will be able to keep it. Let me repeat that. If you like your plan, you'll be able to keep it.
But it wasn't true. Many plans disappeared because they did not comply with the ACA regulations. Many states have lost more than 80% of their insurers. Alabama went from 23 to 3. Arkansas went from 24 to 4. And Wyoming from 21 to just 1. And finally, speaking at the signing ceremony, President Obama said this:
And we have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their health care.
Now, the ACA originally mandated that all residents buy a health insurance policy or face a fine or penalty. But President Trump's Tax Cuts and Jobs Act repealed the penalty, making the mandate essentially just a hollow threat. And in the end, the cost of providing essential health benefits didn't just go away because Obamacare mandated that insurance companies had to provide them free of charge. Insurers raised premiums and deductibles and copays in response to all of this. And because we don't have a government to regulate it, to say, stop doing that, or at least give us some justification for why you're doing it, we end up with the runaway freight train of healthcare that currently exists. A system that, again, essentially says,
right, the points are as worthless as the phrase campaign finance reform.
And yeah, healthcare is a business. Providing healthcare to sick people without simultaneously bankrupting them isn't exactly a recipe for how you afford your next yacht if you're the CEO of one of these companies. And listen, I know that a lot of this sounds like a heck of a lot of doom and gloom. It kind of is. But if I was to speak a little bit more personally here, I've still never really supported the idea of repealing Obamacare altogether. At least not unless you actually had an actionable plan in place to replace it immediately. In my opinion, it would kind of be like an airline canceling your flight home without immediately providing you with a solution on a reroute. The Republicans' historical pushes to repeal Obamacare always left me feeling like they would just leave me stranded at the airport indefinitely. And in the end, there is some good that did come out of Obamacare. The stipulation that young adults would be able to stay on their parents' policies until they're 26. The stipulation that Americans with pre-existing conditions cannot be denied coverage or price gouged with sky-high premiums for health ailments they can't control. All great things, in my opinion. But yeah, if Obamacare was supposed to be this movement towards affordable healthcare, it was more of just like a tiny little ripple instead of a tidal wave change to the entire system.
This sicko socialism would cost roughly $32.6 trillion over 10 years. Even if you doubled tax collections from individuals and corporations, yes, that means you'd be paying twice what you already do in taxes. That still doesn't cover the tab. My God, free healthcare is expensive.
It's been said that a giraffe is a horse designed by Congress. My guess is that any universal healthcare system devised by the US government with the healthcare and big pharma lobbyists in their ears will end up looking a lot more like a wounded giraffe than a healthy horse. Rather than rely on universal healthcare models currently working in Canada and Europe, I think it's far more likely that we're probably going to get a system that will be largely based on an expansion of the existing Medicare system that's been supported most loudly by Senator Sanders. Just like the health insurance that most of you carry now in the United States, Medicare doesn't actually pay all of your medical bills. For example, under Medicare Part B, you have to pay 20% of outpatient services costs after you pay your annual deductible. For this reason, many people who are on Medicare also maintain a Medicare supplement that pays the costs that Medicare doesn't. There's a premium, of course, for that as well. And remember, these monthly premiums are not factored into the current portion of the FICA tax that's used to pay for Medicare. It's an additional cost to participants. An expansion of Medicare to the general population would almost certainly still include these premiums, in addition to probably paying higher taxes. And that's before factoring in the additional costs that will occur when the some 94 million individuals who are enrolled in Medicaid and CHIP in the 50 states and the District of Columbia are rolled into the national plan with its upgraded benefits. And it's worth noting that some medical providers actually just flat out refuse to work with Medicare participants because of the low reimbursement for services. So how all of this is going to play out if we were to expand it to the entire population is definitely still up for debate. But I want to leave this video on a positive note, or at least a hopeful one. The Commonwealth Institute examined the healthcare systems in 11 high-income countries. The measurements took into account how easily people can access care, administrative procedures, and equity around this care, and the quality of healthcare outcomes. Norway, the Netherlands, and Australia were the countries with the best healthcare in the world. But the US has come in dead last in 6 of the last 8 years. Now, some of you might disagree with their assessment, but that doesn't mean that we, as Americans, don't have a lot to learn from other countries and how they operate. After all, they're able to provide comparable healthcare at about half the per capita cost that we do. That means there's something big that we're just choosing to ignore. But it's not too late. It doesn't have to be too late. We just need to look at other models and keep our eyes open to them. But I'm just one person, and I certainly don't have the answer to all of these problems. And that's the final question that I want to leave to you today at the end of this video. What ideas do you have for the American system that you think on a structural, fundamental level could actually change things for the better? Completely recognizing that a lot of these things are tied to one another, right? You know, healthcare, education, tort reform. These are huge, massive things. And often Congress works at a glacial pace. It's not gonna happen overnight. But I think starting this conversation and having one that's productive can be just so fascinating. So I'm really looking forward to hearing your comments down below and seeing what ideas you have. What suggestions, if you're European, do you have for the Americans? And as an American, what things would you like to see change in your own home country? Please let me know down below. And as always, if you enjoyed what you saw today, be sure to hit that thumbs up button. And for more content from Type Ashton, hit that subscribe button. So, I'll see you next Sunday. Tschüss!